Okay, attachment release for the pec minor. After you thoroughly warm the muscle, we're going to perform our longitudinal frictions in that oblique direction. So sinking in and frictioning from superior to inferior to avoid butting up into the bony prominence. So, longitudinal frictioning until that pain decreases, followed by cross fiber frictioning from medial to lateral on that oblique angle, again to avoid butting up into the clavicle until the pain decreases. And now in the costal insertions, depending on the body composition of your patient, you might be able to treat them directly off of the rib, but some people are either not comfortable with that or you're unable to access that area. So again, if you're imagining pec minors roughly going in this direction, I could perform my longitudinal frictions this way. And then my cross fiber frictions from medial to lateral this way. Frictioning in both directions until the pain starts to decrease. Third option, if you abduct the arm slightly, you can reach into the axilla underneath the border of pectoralis major and slide up the ribs as close as you can get. To those insertions, sorry. And then if I was longitudinally frictioning, I'm going to move my bottom hand kind of in this direction from inferior to superior. And then from lateral to medial for my cross fiber frictions. If you're not sure if you're on the muscle, you can get them to very gently push their shoulder up into one finger. Good, and relax, and you should feel that contract against the edge of your finger. And this way is probably a better way to directly reach pec minor because you're not going through the fibers of pec major and any breast tissue. But again, depending on the patient, it might be less comfortable. The third way, if you lay on your side for me, please.
Which side?
This side. The third way is coming in sideline. Following the margins of the ribs. My wife said she doesn't think you can see me. Following the margins of the ribs until you get up to that border of pec minor, and again you can use that activating force of gentle shoulder protraction to confirm if you're there or not. Right? And on your back again, please. To approximate pec minor, there are a couple different options. Again, one is standing on the contralateral side, palpating for that tender point, then grabbing the arm and pulling towards yourself in that oblique direction in order to protract the shoulder. Once you find the position of relief, holding for 90 seconds. Or palpating here, coming underneath the shoulder and adding that passive protraction. This way typically is harder for patients to relax into, so I prefer the grasp of the wrist.